Let me tell you a story about a family I worked with, and I'll call them the Parkers. Three siblings, three different states, one aging mother whose health was changing fast. Mom wasn't taking her medications consistently. She was missing doctor appointments. Her fridge was empty some weeks and overflowing the next, and every sibling thought others were handling things. Sound familiar? Things finally reached a breaking point when their mom fell, a preventable fall because no one realized she had stopped using her walker. That's when they reached out for help, and I connected them with the geriatric care manager. Within a week, 1 week, the care manager had coordinated medical appointments, updated the medication list, evaluated home safety risks, and created a care plan that actually addressed the family's stress points. One sibling said, "Why didn't we do this sooner?" That's exactly what today's episode is about. Hi, I'm Corpus, a senior transition specialist and real estate expert based in the San Francisco Bay Area and a fellow member of the Sandwich Generation. This is another episode of Sandwich Generation Solutions powered by the Simplify Senior Transitions podcast, where I help families navigate aging, housing transitions, and caregiving with more clarity and less chaos. Today, we're talking about one of the most understood and most valuable professionals in senior care, the geriatric care manager. What they really do, why they're worth every penny, and why most families don't call them until they're in a full-blown crisis. Let's dive in. A geriatric care manager, sometimes called an aging life care professional, is basically a project manager for aging. They help families navigate healthcare, housing decisions, safety concerns, cognitive changes, caregiver stress, resources and benefits, family conflict, and crisis management. Think of them as your family's care quarterback, the person who sees the full picture, the one who keeps everyone on the same page. If you've ever felt like you're managing 12 things at once for your aging parent, this is the professional who takes that load off your shoulders. So, what they actually do that families misunderstand. Here's what geriatric care managers typically handle. 1, comprehensive in-home assessment. They look at mobility, medication management, cognitive changes, nutrition, fall risks, safety hazards, social isolation, daily routines, and medical history. Most families only see symptoms. Care managers see patterns and identify issues you didn't even know were there. 2, creating a personalized care plan. This isn't a generic checklist. It's a detailed roadmap tailored to your parents' health, home, routine, and goals. It answers what support do they need, what's urgent versus optional, what's the safest housing option, and what resources should be brought in now and later. 3, coordinating doctors, medications, and appointments. This is the part every family underestimates. Care managers attend doctor visits with your parent, update medical files, catch medication errors, ensure every provider talks to each other, and prevent unnecessary ER visits. 4, crisis prevention. Falls, medication mistakes, sudden confusion, unsafe choices, and caregiver burnout. These issues often build for months before a big crisis hits. Care managers see the early signs and intervene. 5, mediating family disagreements. Let's be honest, senior care brings out different opinions in siblings. Care managers stay neutral, clarify roles, keep conversations productive, prevent resentment, and make sure the parents' needs stay central. They protect the family relationships while ensuring your parent is safe. 6, navigating senior living or keeping parents home. Care managers guide families on aging in place, home safety upgrades, selecting care agencies, touring assisted living memory care, transition planning, and when the time comes to move, they help your parent adjust emotionally and socially. So why families wait too long? Most families call after something has already gone wrong. a fall, a hospitalization, a sudden cognitive decline, a caregiver breakdown, chaos between siblings. Here's why people delay. They think it's not that bad yet. They assume the doctor will guide them. They want to save money. They don't realize help exists, or they're overwhelmed and frozen. But waiting often leads to higher costs, more stress, faster decline, and fewer options. Calling a care manager early is like buying peace of mind before you need it. Let's go back to the story that I started with the Parkers. Here's what their care manager did. Identified fall hazards, updated medication list, got mom's hearing aids repaired, scheduled overdue appointments, brought in a caregiver 3 times a week, mediated a sibling disagreement, checked on her weekly, ensured her legal documents were updated, and helped plan future housing options. Within 3 months, mom was safer, healthier, and happier, and the siblings stopped arguing and started working together. That's the value. So when might you need a care manager? Ask yourself, are you getting calls from your parent multiple times a day? Are you unsure what level of care they truly need? Are siblings disagreeing or avoiding conversations? Has your parent had more falls or confusion lately? Are medical appointments getting overwhelming? Are you burning out? If you said yes to even one, a geriatric care manager could change everything. Okay, let's summarize what we just covered. 1, what geriatric care managers really do. 2, how they simplify healthcare, logistics, and emotional stress. 3, why families wait too long. And 4, when it's time to bring one in. If you're navigating this alone, you don't have to. This has been another episode of Sandwich Generation Solutions powered by the Simplify Senior Transitions podcast. If your loved one is considering senior living and you need to figure out what to do with their home, let's talk. Schedule a free consultation and learn more about my services at www.simplifyseniortransitions.com or DM me anytime on Instagram at SoulByDale. And don't forget, you could also listen on YouTube, Spotify, and Apple Podcasts. If this episode helped you understand care managers better, hit like, subscribe, and share this episode with someone who needs it. I'm Dale Corpus, and I'll see you on the next episode.